Hello everyone. I am Dr. Lubna Gamal, ICU consultant and highly interested in medical education. Let me please introduce for you our trial in medical education uh, titled by Medical Education for All. Uh, we believe that every healthcare provider is an educator. Um, and one of the important responsibility of healthcare provider is to transmit the medical knowledge, skills, and attitude to others. Our nurses, as integrated member in healthcare system, obliged to update their knowledge and skill in medical education field to be able to train peers and junior staff effectively. Um, so um, um, we we know that medical education terminologies are highly sophisticated and difficult. It seems to be academic language and not easy to apply in daily activity work, especially for our superheroes, our nurses, Ministry of Health and Population. Vision is to simplify the science and introduce new approaches in training program to develop the professional plan of nurse staff. ETOT is an Egyptian team consists of consultants of different clinical specialists who are interested in medical education. They are aiming to illustrate fundamental of medical education to all healthcare providers to create professional on-job trainers that will enhance healthcare service. So we decide to schedule a simplified program to teach 100 high nurses how to lay out an educational design and as an outcome to 5-day physical training course. And this training course aim to explain easily the educational domain in team design based learning approach. Our aim of the work is to deliver fundamental of medical education science to non-academic healthcare provider in updated simplified technique and to make sure of integration of medical education principle and active teaching methodology in a daily training activity. Our methodology was a training program target to our audience of high nurse educator who are seeking to develop skills in medical education, aiming to make every trainee able to conduct training need assessment, set educational objective, identify learner style and deal with difficult learner, design a curriculum, use active teaching methodology in training process, design effective PowerPoint presentation and use presentation skills, assess and evaluate the trainee, and create an educational design. So our trainee divided to 5 teams for hand-on after receiving an interactive lecture about the topic of practice, and every team are obligated to endorse review about educational design or educational workshop in form of PowerPoint presentation. Every day, our trainee will be asked to develop new step in educational design, either training need assessment, smart objective, ascending Bloom's pyramid step, design and integrate active teaching strategy, uh, ideas about method of evaluation, effective PowerPoints of the skills and communication skills would be considered. And this our teaching methodology we used in our training program. Our program evaluation was internal program evaluator and evaluator of each lecture done after presented overall evaluation by survey evaluation result announced and discussed, and there was external evaluation also pre-test and post-test comparison was considered. Release plan, course map, course control, dictionary pre-work, trainee support, helping tool, all were mentioned with full details in candidate training manual. We did a survey, evaluation survey was done. This is a link, and this is the evaluation result. Our trainee onward, they said, now we can to implement and integrate what we learned into our training program. We will start to design our own educational project. So, using active teaching methodology, team based learning, design based learning, in hand on session, facilitate and simplify the difficult and academic language of medical education science. Training on how to create an educational design enable high nurses to think about how to make their training program more interactive, evidence based, and updated. Conclusion: all of healthcare providers can learn and practice medical education science. Thank you.